As adults age, the body's ability to recover from injury, surgery, or fractures becomes slower and more challenging, making nutrition, particularly protein intake, a critical factor in recovery. Protein provides the essential building blocks needed for tissue repair, immune function, and wound healing, and its role becomes even more important in older adults because muscle protein synthesis, collagen production, and immune responses naturally decline with age. The encouraging news is that prioritizing sufficient protein can accelerate recovery, preserve lean mass, reduce complications, and improve overall rehabilitation outcomes, turning what can feel like a slow healing process into a more efficient and empowering one. When injury occurs, whether a minor strain, bone fracture, or surgical procedure, the body enters a state of increased protein demand. Amino acids from protein are used to rebuild damaged muscle fibers, synthesize collagen for tendons, ligaments, and skin, and produce immune proteins that fight infection and control inflammation. For older adults, who may already be experiencing anabolic resistance and lower baseline protein intake, these processes are less efficient. Without adequate protein, healing slows, muscle mass declines, and recovery outcomes can be compromised. Conversely, consuming sufficient protein ensures the body has a steady supply of essential amino acids to actively support tissue repair and maintain strength during the rehabilitation period. Collagen synthesis, in particular, is a key aspect of recovery where protein intake makes a notable difference. Collagen provides structure to skin, cartilage, bones, and connective tissues, all of which are critical during healing after fractures or surgery. Older adults often have reduced collagen production, which can impair wound closure, scar quality, and bone repair. Adequate protein, especially sources rich in glycine, proline, and lysine, found in eggs, dairy, poultry, and gelatin-rich foods, supports collagen formation. Some studies also suggest that combining protein intake with vitamin C, zinc, and other micronutrients further enhances collagen synthesis and wound strength. Muscle preservation is another essential factor. Immobility due to injury or surgery often accelerates muscle loss in older adults, which can lead to decreased mobility, higher risk of falls, and slower functional recovery. Ensuring protein intake of approximately 1.2 to 1.5 grams per kilogram of body weight per day, slightly higher than standard recommendations, helps preserve lean mass during periods of reduced activity. Even distributing protein across meals and incorporating protein-rich snacks ensures that amino acids are consistently available for repair and maintenance. For older adults, small adjustments such as adding Greek yogurt, eggs, soft cheeses, beans, or a protein smoothie can provide meaningful support without requiring large meal volumes, which can be challenging during recovery. Protein also enhances immune function, which indirectly supports recovery. Infections and prolonged inflammation are common complications after surgery or injury in older adults, and amino acids are critical for antibody production, immune cell proliferation, and regulation of inflammatory responses. By meeting protein needs, seniors improve their capacity to respond to stress and injury, reducing the likelihood of complications and supporting faster overall recovery. Timing of protein intake can further amplify recovery benefits. Research indicates that consuming protein soon after surgery or injury and continuing at regular intervals throughout the day maximizes tissue repair and muscle protein synthesis. Practical strategies include adding protein to breakfast, e.g., eggs or yogurt, lunch, e.g., lentil salad or chicken, and dinner, e.g., fish or tofu, with snacks like nuts, milk, or edamame bridging gaps. For those with reduced appetite or chewing difficulties, protein-enriched smoothies, soups, or soft foods can provide concentrated sources of essential amino acids without overwhelming the digestive system. Finally, combining adequate protein intake with gentle rehabilitation exercises, when medically approved, enhances outcomes. Even light resistance training, mobility exercises, or physical therapy sessions are more effective when the body has sufficient protein to repair microdamage, maintain lean mass, and support energy levels. This combination accelerates functional recovery, restores strength, and helps older adults return to independence more quickly. The overall message is highly positive. Protein is a potent ally in recovery for older adults. By supporting tissue repair, wound healing, muscle preservation, and immune function, sufficient protein intake transforms recovery from a slow, vulnerable period into a more efficient, resilient process. With thoughtful meal planning, accessible protein sources, and consistent intake, older adults can heal faster, regain function, and emerge from injury or surgery stronger and more capable than before. Protein is not just a nutrient, it is a critical tool for thriving even in times of vulnerability.